all the so-called Rage Festival events have now been postponed indefinitely following a COVID-19 outbreak after one of these year-end parties was held in Durban recently. Health Minister Dr Zweli Mkhize has warned against such gatherings and has described them as super spreaders of the virus because they are attended by large groups of people and involve a lot of alcohol consumption. Now, after the Rage Festival in Ballito, there are now reports that intensive care units at some local private hospitals are currently full with many young people who attended the event. And to tell us more about the dangers of super spreaders is Dr Harry Moultrie, who's a clinical epidemiologist at the National Institute for Communicable Diseases. Dr Moultrie, thanks so much for your time. Welcome to Morning Live.
Good morning, Sakina. Good morning to your listeners. Good to be here.
So, Dr. Moultrie, if we could just start by talking about the department issuing, of course, that urgent notice to all matrics who recently attended any of these Rage festivals to self-quarantine. What are the dangers if indeed the learners don't heed this call?
Thanks, Sakina. What NICD is aware of is that we've seen a large number of COVID cases amongst young students, young men and women, who after matric have attended a party, a series of events in Planga and Ballito. And a large number of those children are now testing positive. I suppose I should call them young men and women rather than children. But a lot of them are testing positive and quite a lot of them are symptomatic. Now, there are risks both to the young men and women, the adolescents who attended the parties. We have seen more than 4,000 people under the age of 19 being admitted with COVID during the course of the epidemic so far. So there's a risk to their own health, but there's also a substantial risk that this sudden increase in large numbers of cases can result in increased transmission. So a lot of these students came from KwaZulu-Natal and Gauteng, and as they return home to their homes, there's a considerable risk that they're going to transmit to their immediate family, but also through potentially into the wider communities, which could result in a substantial increase in number of cases and pressure on our healthcare service. So there really is a risk, sick people and people eventually dying potentially as a result of large numbers of cases arising from the super spreader event.
Dr. Moultrie, how fast does the virus spread at such events?
It's a good question. Super spreader events have been documented quite widely, or in multiple parts of the world. In fact, there's a nice group at the London School of Hygiene and Tropical Medicine which maintains a spreadsheet of super spreader events across the world, and there really are hundreds of them. It does seem that these events are responsible for driving the vast majority of, or a high proportion of transmissions and infections. We know that on average, people transmit, an infected person on average will transmit to 3 other people. But that's an oversimplification because the vast majority of people actually don't transmit to anyone, whereas a small number transmit to a very large number of people. So these 20% of people who may be, or events which may be resulting in 80% of infections can result in substantially driving our epidemics. So these super spread events really are quite difficult in terms of maintaining control over the epidemic. Within an event like this, I think we've got to accept that, teenagers, matric rages, alcohol involved to some extent, the guard goes down, perhaps quite a lot of kissing goes down, which I imagine is a very effective way of transmitting the virus. And so it seems to have been in this particular event incredibly effective at transmitting the virus through these teenagers.
So you spoke about, how small numbers of people then actually transmit this virus to larger numbers. Is this what we mean by the cluster outbreaks? And how true is it that the increase in cases in the Nelson Mandela Bay Metro, for example, is as a result, is related to 2 universities that held events and that led to cluster outbreaks in that metro and in the province?
So a cluster outbreak, Sakina, is where we were able to identify the transmission links. When clusters, when a new case arrives, we've got a fairly good idea of from whom they acquired the virus or where they acquired the virus. So a cluster really is a situation where you can track back and see the transmission of the virus. That's opposed to widespread community transmission. When we see a new infected individual, we simply don't know where they acquired the virus because there's so much transmission and so many cases happening in the environment. With regards to Nelson Mandela Bay, what we did see is that arising out of parties at universities and the cluster amongst university students, we saw quite a high proportion of cases in early October within the age range of 15 to 25 years of age. And then about 3 weeks later, we very suddenly saw widespread community transmission with a sort of an age pattern of the general population, and as we had seen in the first wave. It's quite difficult to be absolutely certain and to prove that this cluster amongst the university students resulted in the widespread community transmission. But it does seem the most likely hypothesis. We have seen this happen elsewhere. It certainly does appear to me that partly the Nelson Mandela Bay resurgence has started off certainly amongst university students.
Dr. Moultrie, just going back to the KZN rage event and the reports that ICU beds are filling up or are full. We were initially told, at the start that young people, by and large, would be asymptomatic when they contracted this virus because their systems would be able to fight and, withstand whatever the virus brought. So has that changed, or is there something peculiar in what we are seeing in KZN at the moment?
No, there's nothing peculiar. Perhaps there's a misunderstanding here, Sakina. So younger adults, or the severity of COVID is strongly age associated. So older people much more likely to have more severe disease. And that remains the case at this time. The point about the KwaZulu-Natal hospitals is that if you've got a hospital system that's already under pressure, and from other conditions, either from COVID or from other healthcare conditions. And now into that, you suddenly increase the number of COVID cases, young adults transmitting to their parents and grandparents, the health system's going to be under pressure. There's no assertion that the hospitalizations currently in KwaZulu-Natal ICU are in fact out of the rage events. I don't think that's the case. The point is that the health system's under pressure in these areas.
And we are, of course, seeing at the moment, Dr. Moultrie, an increase in the number of new infections every day. We've seen over the past few weeks, maybe going into over a month, already above the 2,000 figure, a number of daily increases. What is this indicative of, if anything in particular?
We're watching the epidemic quite carefully and these resurgences quite carefully. And having looked at the example of the Eastern Cape, the conclusion that we've come to is that the reports we're getting from people on the ground is that communities are getting COVID fatigue and battling to maintain their social distancing. They're battling to maintain their mask wearing. We're having more mobility, perhaps, and more contacts. And this is resulting in increased transmission. And we're not only seeing it in the Eastern Cape, obviously the Western Cape has also had a substantial resurgence. But more recently, I'm quite worried about areas of Johannesburg and some areas of KwaZulu-Natal, particularly eThekwini, Ilembe, Ugu's districts, where we're seeing sustained increase in cases. And I suppose what this is driven by is people are moving more, perhaps, and people are coming into closer contact with each other, which enables the virus to spread. So we're seeing more cases.
And we are, of course, heading into the festive season, Dr. Moultrie, and there are real concerns about what could happen at this time, given that we all acknowledge it's been a very tough year. It's been a very difficult year. You and I spoke off air before the interview about things like COVID fatigue and, people just looking for an opportunity to let their hair down, as it were. But you were saying this needs to be done responsibly. What does that mean?
So that's right. It's been a tough year, and we're all looking and need some joy and happiness in our lives. And going into the Christmas season, it's often a time where we have a bit of a break and we reset and we prepare for the next year. The important thing for us to do is to make sure that we find that happiness and joy, but in a way which is responsible. And really the key issues here are avoid mass gatherings. If you have a large number of people gathered in one place, there's a very high probability that at least one person in that gathering will have COVID. And the more people you have in one place, the possibility of having one positive person in that gathering actually increases exponentially. So first of all, let's avoid mass gatherings. Let's avoid large confined spaces, indoors. These kinds of environments facilitate the transmission of COVID incredibly effectively. So the advice we have to have, and we will have to try and take on board is find ways which are relatively safe to enjoy ourselves. And we can't get our risk to zero, Sakina. We go to the shops, we interact with the world. It's not possible to get to zero risk, but we have to think about how we spend the risk pool that we do spend. And I would suggest that outdoor activities, doing that with small groups of people, with your family, are perhaps the ways that we can responsibly find a bit of happiness and joy during this Christmas period.
Well, Dr. Harry Moultrie, thanks so much for your time. Clinical epidemiologist at the National Institute for Communicable Diseases, talking to us about super spreader events that have the potential of infecting large groups of people as more and more gatherings are scheduled for the festive season.